Welcome to UMCC Medical Consultant Connector, where your health matters to us. Let's talk about gonorrhea, shall we? Don't worry, it's not a gourmet cheese, though I wouldn't blame you for hoping. Gonorrhea is a sexually transmitted infection, and trust me, it's about as welcome as a skunk at a garden party. Understanding this uninvited guest is the first step in showing it the door. We'll delve into the causes, spot the warning signs, and learn how to evict it for good. Think of your body as a bustling city. It's usually a happening place, full of good bacteria and healthy cells going about their business. But sometimes an unwanted visitor shows up and disrupts the peace. That's gonorrhea for you, the party crasher nobody invited. The good news is, with a little knowledge and a dash of caution, we can keep our cities safe and gonorrhea-free. So, buckle up as we embark on this journey to understand, outsmart, and ultimately defeat this unwelcome guest. So, what exactly causes this gonorrhea ruckus? The culprit is a bacterium with a tongue-twisting name, Neisseria gonorrhoeae. Now this bacterium is a smooth operator, spreading through sexual contact like a whisper in the wind. We're talking unprotected sex here, vaginal, anal, or oral. It's like sharing a drink with someone, but instead of a sip of soda, you're getting a mouthful of bacteria. And trust me, this is one drink you don't want to try. The sneaky thing about gonorrhea is that you can carry it and spread it without even knowing. It's like being a secret agent, but instead of cool gadgets, you're carrying an unwelcome infection. But don't worry, we'll arm you with the knowledge to detect this secret agent. Now that we know the party crasher, let's talk about how to spot it. Unfortunately, gonorrhea is a master of disguise. Sometimes it throws a big, loud party, making its presence known with obvious symptoms. Other times it sneaks in quietly like a ninja in the night with no signs at all. Ladies, if you experience unusual discharge, burning during urination, or pelvic pain, gonorrhea might be the uninvited guest crashing at your place. Gentlemen, keep an eye out for discharge from the penis, testicular pain, or a burning sensation while peeing. These could be gonorrhea's calling cards. The important thing to remember is, if you notice anything unusual, don't ignore it. It's always better to err on the side of caution and get checked out. Section 4. Unmasking the intruder, diagnosis and testing. Okay, so you suspect gonorrhea might be lurking in the shadows. How do we confirm its presence? Well, it's time to call in the detectives, the medical professionals. They have a few tricks up their sleeves to unmask this unwelcome guest. First, they'll ask you about your sexual history. Don't be shy. Honesty is key here. They'll then take a urine sample or a swab from the affected area. Think of it like taking fingerprints at a crime scene. These samples are then whisked away to a laboratory for analysis. The lab technicians, our forensic experts, will analyze the samples to identify the culprit. They'll be able to tell us if gonorrhea is present, and if so, how best to kick it out. Section 5, showing gonorrhea the exit treatment options. So, the verdict is in, and gonorrhea has overstayed its welcome. Time to show it the exit. The good news is that once diagnosed, gonorrhea is usually quite treatable. Our weapon of choice? Antibiotics. Doctors typically prescribe antibiotics to knock out the infection. It's like sending in a SWAT team to clear out the unwelcome guests. It's crucial to follow the doctor's instructions carefully and complete the entire course of antibiotics, even if the symptoms disappear before that. We want to ensure that gonorrhea is evicted completely and doesn't even think about coming back for a sequel. Remember, sharing is caring, but not when it comes to antibiotics. Taking someone else's medication or self-treating can be dangerous and might even make the bacteria resistant to treatment. So, leave the prescribing to the professionals. Section 6. Keeping gonorrhea at bay, prevention strategies. Prevention is always better than cure, right? And when it comes to gonorrhea, this rings truer than ever. The best way to avoid this party crasher is to practice safe sex. Think of condoms as the superheroes of the sexual health world. They act as a barrier, preventing the exchange of bodily fluids and keeping those pesky bacteria at bay. It's like having a bouncer at the door of your body, only allowing the right people in. Open communication with your partner about sexual health is also crucial. Regular testing for STIs is like a security check, ensuring that everything is in order. And if you do have gonorrhea, it's important to inform your partners so they can get tested and treated as well. Remember, taking care of your sexual health is a sign of self-respect and responsibility. So, be proactive, be informed, and keep those unwanted guests at bay. Well folks, that's gonorrhea in a nutshell. Or should I say, a petri dish. Remember, knowledge is power. And armed with the information in this essay, you're well equipped to keep this unwelcome guest from crashing your party. Stay safe, stay informed, and keep those good times rolling, responsibly of course. UMCC, your ultimate medical consultant connector.